Two patients, same disease, same cancer, even the same stage, but their outcomes are completely different. Why? I am Dr. Harsha, consultant surgical oncologist and robotic surgeon working with SAC. In my day-to-day practice, when a patient comes and asks this question, Doctor, what should we do to prevent cancer? Is there any vaccine to prevent cancer? What is the treatment for cancer? The common misunderstanding in all these questions is assumption that cancer is a single disease. No, cancer is not a single disease. It's a heterogeneous group of conditions which behave in the same way. The basic behavior of cancer is disease which starts in one part of the body, which has a tendency to and which can spread to other part of body is called cancer. How does the cancer start? To understand this, we need to go back to our basic high school biology. We all know that all the living organisms are formed of cells. These cells, they build tissues. The tissues, they form organs, organ form organ systems, and organ systems form a human being. So in this sequence, the cells have to divide and replicate to form tissues, right? So during that replication, our body is in a constant state of tissue damage and tissue regeneration and repair. So in that sequence, whenever this process is very tightly regulated by our DNA, the information contained in our DNA, whenever this process gets disturbed, whenever there is an error in the DNA, whenever there is an error in the replication process, these cells, they form an unorganized mass of cells called tumors. These tumors, they don't have any purpose. They don't serve the body. They just compete for resources, and these tumors, they can spread to other parts of the body also by cells being detached from the lump and circulating through blood system and forming tumors elsewhere. This is called cancer. This is the basic premise of cancer. But not all cancers are the same. We can classify cancer based on the organ in which it arises. Like the cancer which arises in breast is breast cancer, in colon it's colon cancer. But to add to the complexity, not all breast cancers are same even. For example, even breast cancer has triple negative breast cancer, HER2 positive type of breast cancer, hormone positive type of breast cancer. All these are completely different in terms of behavior. Some respond very well to treatment, some do not respond well. Some respond well to treatment, but they come back aggressively. Some grow or advance very slowly, some grow very fast. So based on their behavior also, even breast cancer, which we can regard as a single disease, it also behaves differently based on the types of breast cancer. So even if the name of the cancer is same, the behavior can be completely different. And add one more layer of complexity, the stage of the disease at which the cancer is diagnosed. Some people can come to doctor very early in their disease status, some can come very late. So depending on that, the treatments they receive is different. And add one more layer of complexity, your body. Your body is unique from the very next person's body sitting next to you. Doses of chemotherapy you tolerate, the form of surgery you can tolerate is completely different from compared to other person. So even cancers with the same name need different treatments. So cancer treatment has to be individualized, and also the responses to treatment. You give same drug to two people, they have two different reactions to the same drug. And especially cancer treatment. Cancer treatment is not just a single day, single event. It is a path. It has to be carefully planned according to the patient's stage at presentation, the disease and subtype of disease, and his body, his tolerance levels and all. We have to make a personalized treatment plan based on a multidisciplinary team meeting. So that plan has to be executed carefully in accordance to the tolerance of the patient. So there are no uniform outcomes which we can promise for each cancer. But the only dictum is early stage cancers, they behave well. When we start treatment early, when we treat them effectively in an evidence-based manner, the outcomes are uniformly better. When we delay treatments, the outcomes are uniformly bad. In the same way, when we follow evidence-based and doctor-recommended treatment approaches, the outcomes are good. When you deviate from the treatment path by choices, then the outcomes are going to be different. So in this heterogeneous disease, what we can understand is when we follow evidence and when we approach the doctor early and when we follow the guided treatment properly, then the outcomes would be better. This is also why comparing cancer journeys can be very dangerous. One person's story cannot predict another person's outcomes. What worked for someone else might not work for you. And also the side effects part. Chemotherapy side effects, they can be overwhelming, but it's not a rule that everyone will have the same side effects. Your body can react to treatments differently, even to surgery. Someone else's tolerance is different from your body. So don't make any assumptions that cancer treatment is always painful, always debilitating. Yes, it is a strong treatment, but we can personalize it according to the patient, and according to the patient, the side effects can and the treatment can be tailored to. It's easy to feel overwhelmed when you hear so many different stories around cancer. You deserve a treatment plan which is built around your diagnosis, your stage at presentation, and your body, not according to the assumptions. So you should consult the right expert who takes time to listen to your problems, who takes time to understand your disease and formulate a personalized, accurate treatment plan. Sometimes starting a treatment is not just the first step, it's the journey in the right direction which matters.